Cvts, and Dr. Gopal sir, Organizing Secretary. Now I invite on stage Dr. Amresh sir to give the inaugural address.
Cardiothoracic surgery, I welcome you all to the CVTS Boot Camp 2024. This initiative is the first of its kind. The birth of this idea came from the feedback which we received from our residents that whenever we are going for conferences and sessions, these are not tailored towards us. These are not selected the topics. They are the ones who have selected the way the sessions have to be structured. CVTS as a specialty is facing immense challenges. It is the youngest branch of all the surgical specialties. And as I say, last in, first out, it's always under an existential threat. Right from the first time when they sutured the heart, they took on Bill Roth, who said, whoever touches the heart will lose the respect of their colleagues. Since those days, CVTS has always been under existential threat. Even now they say cardiologists are closer in the mirror than they seem to be. They're going to take away your cases. You are left going to be jobless. This is always an existential threat. Yet, despite all that, we are very proud that CVTS is one of the best surgical branches you can be in. They are the ones who have adopted technology, industrial and space technologies, and the practices of safety and outcomes. So many newer dimensions which are coming up. So we wish to assure our young generation that future of CVTS will be in good hands. There's going to be a good future for cardiac surgery, and we want to expose them to the specialty so that they can take it forward. And for the young surgeons who are already in this specialty, we want them to give a proper orientation to the entire dimension of cardiac surgery. We are happy to say that we have more than 90 registered postgraduate CVTS students. We have around 25 undergraduate students, MBBS graduate students who have registered. We were geared up for around 80 registrations, I think, but we have far exceeded that. I'm sure they love the program, and I'm sure they love the city of Hyderabad as well. This is an inaugural event. We wish to take feedback from everybody, and then we want to make it an yearly feature so that based on the feedback which we receive from here, who have agreed to mentor the students and take on the responsibility of teaching them as well. And I thank the administration of NIMS for their active support, and I wish you all a very warm and hearty welcome to the CVTS Bootcamp.
Thank you, sir, for your inspiring words. Next, I invite on stage Dr. Lisa Rajshekhar, the respected Dean of NIMS, to give a few words.
Respected Director Birappa Garu, Professor Mishra, Dr. Amresh, Dr. Ramakrishna and Dr. Gopal, and seniors in the audience and delegates, it's my privilege to welcome you all to this boot camp. Dr. Amresh told me this a couple of months ago, that the students convey a lot of information, technical expertise to you all in a short period of time. And the fact that this is an idea by the students, for the students, with the help of faculty, I think it's an amazing way to learn and teach, and it brings a true meaning to the word doctor, that when you are a doctor, you are teaching. Most of the time we think that we teach down to our juniors, but we all know that we are always learning, not only from our juniors, from seniors, but interdisciplinary colleagues. So over the last few months, I have had the privilege to attend a few more lectures, demonstrations organized by CTVS department, especially Dr. Amresh, and I have noted keenly how committed they are, not just to their profession, but also to teaching and improving the students which they associate with. They have been very effective in establishing dialogues with anesthetists, and it's been like meetings. Thank you and welcome you all.
Thank you, ma'am, for your excellent words. Now, may we have the lamp lighting, please?
Head of the department, Dr. Amrish, Dr. Ramakrishna, Gopal, and Dr. Mishra, former professor and head of the department of CTVS, and dear senior colleagues and students, and my dear friends, ladies and gentlemen. I didn't understand first what exactly is a boot camp. I never heard this boot camps. It's used for other technical things, I think, but not for surgical things. Anyway, it's basically to learn some of the basic skills. So, I was actually worked in cardiothoracic surgery for 6 months after my post graduation. Simply to say, it was a hell for me. And Satnand Garu, Rajgopal Raj Garu, and Subramanyeshwara, Venkateshwara, and many people. Every time I asked, should I was in diplomatic, whether to continue or not to continue. And everybody said, no, this is a bad branch, don't continue. I said, why? Already I had spent 3 or 4 months and I had not seen sunset, I had not seen sunrise. And already I was getting family pressures. And they used to do, all the 6 consultants, they used to do almost per day 6-7 open heart surgeries, 1,000 open heart surgeries in Nizams. And it was so hectic. And one thing, I was made to do closed mitral valvotomy and lung surgeries. And finally, one day I decided, I think this branch is not for me, even though my ambition was to become a cardiothoracic surgeon. So ambition was lost in midway, and I had to go back to my original surgical department. Anyhow, now I have no regrets for that. But what I feel is, any surgeon, in fact, whether a general surgeon, surgical gastroenterologist, or a surgical oncologist, they have to have 6 months of posting in cardiothoracic department. The reason why I'm saying is that the fear of blood will go. I think that is very important. The first day which I stood for an CFBC, when he showed the cannulation and all, blood was hitting the roof. I mean, it was really surprising. I mean, the amount of blood seen here and there. I'm a believer of a no blood transfusion and no blood in the field. So absolutely clean field. Even if we dissect on the portal vein, I'm very, very careful. Not even a branch is cut or divided without clips or suture. And that kind of personality, and seeing in 2 liters, 3 liters of blood is going through in a pump and in the field, I said this is not a good surgery. And as Ambrose said, existence of the cardiothoracic surgery. And those days, cardiologist was so aggressive, even they used to come and do the post-operative rounds also. They used to peep into the TR, or how is this patient is doing, and outside the patient knows the cardiologist name, but not the cardiothoracic name. They used to say, Somaraj garu operation chesarandi. They never used to say that CT surgeon has done a surgery. So that was the kind of a thing those days. Anyway, it's an excellent branch and it will have an existence, I'm sure. There's no issues about that. Only thing is you need to have a passion. You need to learn, and that is most important for all budding surgeons. I think those who wants to take cardiothoracic surgery just before joining to an MCH, it's better to work in the department, know how that is functioning, because atresia is very high in cardiothoracic surgery and many postgraduates, many seats are going vacant all over the country. I think it's better join some good CT surgery department, work for 3-4 months, that kind of in a branch. So that is most important than, joining, leaving. I've seen so many people joined and left. And finally, they became only lung surgeons and something like and suprahepatic IVC taping and infrahepatic IVC taping. And that kind of confidence you get once you work in a cardiothoracic department. Even if you cut the IVC or any adrenal vein, we used to suture. We never called any surgeon, CT surgeon, unless for an arterial anastomosis. So that way, it really helped me doing liver resections and liver transplants and other things. Thank you very much, and congratulations CTVS department for organizing this show. It's a great show. Thank you very much.
Virappa, Dr. Lija, for inviting me. I think this program, as said, Dr. What is boot camp? I really didn't know. I didn't understand. But now I realize that what it is. It's basically the basic program that I think is going to help residents who are just joined or who are interested in joining. So that is a good initiative. And I think most of the residents or the delegates who are here, they're going to enjoy this basic program. And time, we all know it was because the cardiologists, most of the jobs they have taken over, and most of the guys were not interested because of the hard work and labor, and the end of the day, you're not getting enough jobs. So, I think the cardiac surgery again coming back, and the importance and significance will never be going away, as I said. And I hope all of you are going to enjoy this camp. Thank you very much.
Thank you so much, sir, for your
Thank you everyone for coming, and I'm really glad that R.C. Mishra sir, our senior professor, has also come. It has been a great inspiration, sir. Thank you, Lisa madam, for gracing the occasion. Thank you, Birappa sir, and all the faculty who have from Hyderabad, and our colleagues and other people who have come to train the younger colleagues. Thank you, sir. Thank you, all of you. And thank you, delegates. Almost many residents have come all over the country. So I think it will be of good benefit for you all of at the end of the 2 days sessions. Look forward for a great learning. Thank you so much. Bye.
Excuse me, sir. Thank you.